Hello, everyone. Welcome, welcome. We are so excited to have you all here today at our Community Health Solutions event. We're going to give a moment or two for folks to jump into the room. As we wait, we welcome you to share your name, organization, and in a word or two in the chat, maybe a change that you've seen in your community in the past year that is surprising, or that you didn't see coming. We'd love to know who is in the room and build some community here. We heard from lots of you that there is hope to build more community, more collaboration. And so I invite you into this space to lean in and consider this a digital opportunity, virtual opportunity to collaborate with others.
And if you feel comfortable, we'd love to see your beautiful faces.
Yes.
Hi, Lauren. Look at you on camera. It's nice to see you.
Stepping boldly into the space.
That's
Thank you.
right.
Welcome. Hi, Krista.
Hi,
Hello.
Kristen. Oh, it's the Office of Youth and Community Restoration.
Ah,
Hello,
thank
Lisa. Yes.
you.
A new office in the California HHS system.
Cool.
Mhm.
Health and Human Services.
Yes.
Welcome, folks. Welcome. Excited to have you here today. As you jump in, we just again invite you, if you're willing, to share your name, organization, and in a word or two in the chat, a change maybe that you've seen in your community in the past year that's surprising or that you didn't see coming. Doesn't have to be very profound. Maybe you lost a great coffee shop and you were sad about it. That it can be anything. Um, we just love to know who's all in the room. We like to also give a minute for folks who are jumping from multiple meetings to just jump
Mhm.
in here.
And Lori Houston is with us. That's exciting. Yes.
Hi,
Burger.
thank you.
Hi, welcome.
Somebody's Burger Hut closed. I don't even know what Burger Hut is because I am not local to a Burger Hut, but that sounds tragic.
It does. Oh, yeah. Hmm.
New housing being built, new public
Mm.
market space.
Oh, that's nice. That's awesome.
Hmm.
Ah, okay. There's some Burger Hut fans
I
amongst
love
us.
me a good burger. Healthy one, of course.
That's fun.
New housing and parking garages. Ooh, new play structure. That's great.
Oh, yes.
Can see a lot about what a community values by what they build in the public spaces, right?
Mm-hmm.
Lovely. Well, thank you all for taking just a moment to indulge us in that exercise. We're going to go ahead and get started for today, just to ensure that we have enough time for all the conversation that's to come. So, as I do so, I just want to remind folks that this event is recorded. We are going to place this on our Phil YouTube Community Health Solutions playlist. So, if you want to come back and reflect on this, you'll definitely be getting the recording for that, a link to that. And we are excited to have you here today. We ask that you totally can be on video. I'm not sure why that says not video, but there will be points when you're allowed to unmute here and speak up. We're going to have a time for Q&A. If throughout this event you have questions that come to mind, feel free to place those in the chat. We will circle back to those once we get to the Q&A, and just to remind you to stay on mute while we're during presentation, so that way we don't have too much noise, background noise happening. All right. Well, welcome today, everyone. We are here today at our Community Health Solutions series, and our event for this wonderful period is going to talk about applying future studies to collaborative partnership work. We're super excited to be joined by Aubrey Morgan Yee, who will share a little bit more with you all about what this is all about, future studies. If you've never heard of this, we have a lot of excitement about what is future studies, what does this mean, that we'll get into in just a moment. But up front, I want to just start by sharing a little bit more about the Population Health Innovation Lab for those of you who are not as familiar with our organization. We are a branch or a program of the Public Health Institute based in California. We essentially exist because community change work is really hard. It can feel isolating and completely, deeply complex, very challenging to navigate. And so we exist to help equip communities and change makers to navigate those challenges, to really catalyze equity-centered solutions, strengthen systems, support lasting well-being and transformation in your communities, and create opportunities to experiment, to share learning, and to lead lasting change. So we're excited to be joined by you all today as other change leaders in this space, and we hope that you find great value out of our event today. I want to start us off also with a land acknowledgement. Today, I am working on the ancestral and unceded homelands of the Native Hawaiian or Kanaka Maoli people. I would encourage you to click on the link in the chat. I'll drop that in just a moment to know and hear more about the native lands from which you are living or working on today. I also want to briefly share what Community Health Solutions is all about. So really this series came out of the notion that so much of what is being done and what can be done to improve well-being in a community lasts and holds within the community itself. And so we are here to really showcase breakthrough approaches on operating in the community health space. We like to really bridge traditional community health expertise with innovations and cross-sector solutions. So this is where we're bringing in a whole different kind of way of thinking and studies today to talk about how it intersects with community health. And the real goal here is to just provide practical pathways and guidance for you all to implement things locally. So we invite your questions, your curiosity, your dissent of opinions. We also really appreciate that as well. So welcome to Community Health Solutions. As we jump in, I also just want to briefly share about what you all said you want from today's event. Thank you to those of you who in registration shared a little bit more about what you're trying to get from this event. We love to hear from you all on the things that you're interested in. And top of mind for so many of you is how do I collaborate and partner with folks better? How do I really think about the future and institutionalize thinking about this and the insights and the knowledge that are necessary to do my work better? So many of you are fresh to futures thinking and what this actually means. So this is just a snapshot here of some of the responses. This doesn't include all of them because many of you registered after I had already done some of this. But we're excited to have you here no matter where your inquiry is. I'm hoping that we'll get to several of these points here today. If you, again, have questions that come out throughout the sessions, feel free to place that in the chat and we'll make sure to circle back to those. All right, and with that, I am going to turn it over to our director at the Population Health Innovation Lab, or PHIL, as we lovingly call it, to introduce herself and to share a little bit more about our guest speaker.
Great. Thank you so much, Christina. So my name is Sue Grinnell, and I'm the director of PHIL, and I'm very excited to be with you all today, and excited that Aubrey was willing to spend some time with us and share some of her wisdom. I had the opportunity to meet Aubrey. When was it? Like it was
Like 2018, maybe
something, I don't know. In one of my colleagues, Dana, and I did a project with her in Hawaii. I was very fortunate, and it was with I think the Amidyar Fellows, and it was pretty exciting and amazing. And so we've stayed in touch, since then, and just excited for her to be here. But she is a futurist. She is an author and a facilitator devoted to birthing life, affirming futures through love, remembrance, and sacred action. She holds a PhD in alternative futures and indigenous politics and brings together future studies, systems thinking, spiritual ecology, and earth-based wisdom in all the spaces she leads, from intimate gatherings to global culture labs. She's the founder of Our Beloved Futures, based in Hawaii, and a mother of two. Her work is grounded in is grounded, relational, and deeply embodied. And she supports artists, leaders, and communities in navigating transition, metabolic, I can't talk today, collapse narratives and cultivating futures rooted in care, integrity, and interbeing. And she has a book that I think we have maybe as a resource on one of our slides at the end, Our Beloved Futures. And it's a reckoning with the toxic systems of the modern world, right? An luminous guide for those longing to live in service to collective liberation and planetary well-being. So welcome, Aubrey.
Thank you, Sue. Lots of big words. It's hard
I
to
know.
describe what I do sometimes.
Oh, so wonderful. Well,
Yeah.
Sue and Aubrey, thank you so much for coming up with this opportunity to talk about futures work. I want to just ask you both a question because, obviously we have this series and we think through different topics on what we should be talking about. I'd love to open us up with just a moment where you two both can share a little bit about why is right now the right time to be talking about future studies? What should a collaborative partnership be thinking about now for the future? So I'd love to hear from you both before we jump into presentation.
I could start that, Sue. So the field of future studies came out of the 1970s when there was back then an existential crisis around, realizing what we were doing to the earth, the ability, nuclear weapons, all these things. So the field itself came out of that understanding that we as human beings were reaching the limits of growth, that we were, overspending our capacity to exist in harmony with nature, and that we could potentially extinct ourselves. And I would say that we're in that inquiry now even more than then, right? So to me, futures thinking is an organizing principle. It's a way of being in the world, it's a way of organizing ourselves and thinking about what it is that's both coming towards us. So, like, what are the futures that are being fed to us? And then what's even more interesting to me is how do we then become productive stewards of the futures? So the futures are always emerging, right? They're coming out of this cultural milieu and this collective understanding of what it means to be human. And how do we steward that in the direction we would like to see it going? So I see it as a really powerful tool for collaborations. It becomes part of systems change endeavors. Any sort of systems change endeavor, I think, should first look into the futures and see, both the alternatives that are coming that we maybe don't want, and then what are the preferred futures that we're visioning together. And those conversations can be incredibly powerful. So I'm not interested in predicting. I'll talk about that a little more in my slide deck. People will be like, what do you think is going to happen? And I'm like, nobody knows. That's the point. Like, we together get to determine what the shape of the future looks like, and it's not going to be one thing, right? So we get out of that sort of top-down control approach, like I want to know exactly what's going to happen, and we start to engage with the mystery of life, and that's where the magic really happens. And I think people who do collaborative work understand that more intrinsically than others who are interested in more kind of typical hierarchical systems of maintaining organizations and control. So I'll stop there and see what Sue wants to add.
I have been probably over the last, how long has it been? Year and a half? I don't know. It's been a painful time. Just thinking a lot about the annihilation of what's happening to our world, and very worried. And we do so much work with collaborative partnerships and supporting them. And I think as Christina and I were talking about what should the topic be, this came up, right, in terms of creating a space to talk about this. I wonder a lot about, are people thinking into the future, like 3 years from now, and what we can be doing now, right, to prepare for the rebuilding? Because I don't know that what we want is the same old, right? Because the systems that we had previous to what's happening currently didn't necessarily work. So I think it's a great opportunity for those of you that are in collaborative partnerships, either supporting them or leading them, to be able to cultivate these kinds of conversations, like what is the future that we want in our communities. And so I'm excited that Aubrey's here and that we can dive in a little bit more. So yeah.
Okay, so let's dive in. Beautiful. Thank you, Sue. I think that's all really true. And I'll speak a little bit about what I call becoming collapse aware. So I titled this talk Futures Thinking for Systems Transformation because I think that's really what we're all here thinking about is how do we transform systems to become what I call more committed to life or life-centric, centered in love, and also building cultures of care. So really cultures that center on care for other, care for the more than human world, care for the earth. What does it look like to recenter everything we do around these values of really loving our earth and loving each other, right? So that's for me, when I speak of the beloved futures, that's what I'm thinking about. You can go to the next slide. So since I think everyone here is interested in systems change, I want to share these three thought forms and see how they land in you. Notice if they feel useful or familiar or new, how they land in your system. So the first is that you cannot change a system unless you transform consciousness. You cannot change a system unless you transform consciousness. And I think about that in terms of individual consciousness and the consciousness of the collective, whatever that collective might be. If it's a network, if it's a community, if it's an organization, you can't change the system unless you transform consciousness. And what this means is we're not actually after surface level changes. We're after literally changing the consciousness of the people involved in the system we care about. And so to do that, you cannot transform consciousness unless you help a system see itself as a system. What this means is that systems change best when they change themselves. So you might have heard that before in systems work, but you really can't transform the consciousness of people within a system unless you help them see that they're actually interconnected, that they are a system. This can take a lot of different forms. There's lots of different ways to hold systems, convenings, trainings, network building. I'm sure you're all sort of engaged in different ways of doing this, but you have to help the system see itself. And then the third is that you can't lead systems transformation unless you sense and support the futures that are wanting to emerge. So the futures that are wanting to emerge, meaning that baked into this understanding is that there's futures already forming. They're like in the ethers. They don't yet exist because the future doesn't exist in the now, but it's a conglomeration of all the things that are happening in the present and in the past, and that these futures are wanting to emerge through us. So our job as a systems leader is to sense the futures that want to emerge, to find ways to do that together in our collectives, and then to support the futures that we want to bring into form with whatever infrastructure, policy, community leadership, research, whatever kinds of activations need to happen to bring those futures about. And that's really our work. So you can go to the next slide, which is the paradox of the futures do not exist. So that might feel a little controversial or contradictory to what I just said, but what I mean by this is that the futures cannot exist because they haven't happened yet. But that doesn't mean they aren't already forming, right? So they don't yet exist, but we still have agency in the present moment to create the futures that we want to see. So this is where the agency lies in the recognition and the recognizing that the futures don't yet exist, but that there are futures forming. And if we become aware of them, then we can actually shape what comes our way. So we have to become aware of the choices we're currently making. We have to understand the historical context of the system we care about, and we have to take effective action based on the futures that we can sense are already emerging. So if the futures that are already emerging are ones that we don't want, we'll take different action than if the futures that are already emerging are ones that align with our preferred vision of how we wish the world to be. So that discernment is where all the magic lies. In the next slide, I'll talk about images of the future. So while the futures do not exist, images of the futures do. And you notice I use futures with an S because there's always unlimited possibilities. We can't talk about one future. There's multiple possible futures always. So images of the future exist in the present moment in the ways that we think about the futures, talk about the futures, image them in media, movies, stories, cultural narratives, art. We're constantly making, consuming, sharing, digesting, recreating, and spreading images of the futures. What's been a worrisome trend for me lately is how many dystopian images of the futures are being created. I believe it's time for those of us who care about a positive future to begin actively, intentionally, and consciously creating preferred images of the futures we actually want to live into, rather than just consuming and spreading images of the dystopian futures we don't want to have happen. If we can't see it, how can we create it? And the next slide. My mentor in my futures doctorate research, his name is Dr. Jim Dater. He had a few things he called laws of the futures. And you saw the first one, which is that the futures do not exist. His second law of the future was that any useful idea about the futures should at first appear to be ridiculous. So he used to tell me that as a futurist, if the room wasn't laughing at me, I hadn't quite done my job yet. The idea behind that is that the ridiculous nature of ideas about the futures means that anything significant about what is coming our way will be so radically different than the present moment that in the current way of thinking, it will appear ridiculous. And so, if we're not getting to that realm of something feeling ridiculous, we're probably not stretching our thinking far enough. In the background of this picture is the first computer. This is recent history. You can imagine at this moment in this room that made like it was like almost a whole floor, I think, made the first computer. If you told people that their grandchildren would be holding more computing power in their hands than this entire room represented, they would have thought you were crazy. So when we're thinking about the futures, we need to be thinking about the ridiculous ideas and allowing our minds to get out of what I call the tyranny of the present, to truly imagine what might change if things advance, if things change, when the current trends and emerging issues merge and become something totally new. We need to think about those kinds of possibilities that seem like they might be crazy. On the next slide. So I hope most of us in this room, as Sue was sharing, are aware that we're living through a time of great transformation. It's been called lots of things, the Great Turning, the polycrisis, the metacrisis. There's lots of different ways, the Anthropocene, different words to use for what we're experiencing. What we do know is that old systems are no longer holding, and in their unraveling, in their collapse, in their dissolution, new possibilities are emerging. It's like the cracks in the concrete where the grass can get through. So it's time to get comfortable with the discomfort of uncertainty. And we have to embrace a cosmology that understands that life is relational, intelligent, and sacred. I believe that when we ground ourselves into the intelligence of life and the intelligence of Earth and the intelligence of our bodies, which are made from Earth, we'll find ways through that allow us to emerge on the other side more thriving, more grounded, and more whole. So, really, everything I do is based in that belief. On the next slide, I'll say, like I said before, we cannot predict futures. I don't predict because I don't believe we can predict. We can instead forecast. We can forecast possibilities, and some may be more probable, some may be more possible, some may feel more impossible. But as we know, the impossible can happen, right? So just because something feels more possible doesn't mean that the less possible thing isn't going to be the thing that happens. We also can transform consciousness, and most importantly, we can empower communities. And I think that forecasting possibilities, doing futures work, transforming consciousness, connecting people, that does empower communities. And that's the kind of futures work that I'm interested in. I find that predictions usually come from people who are trying to sell you something, and they're not really useful. So to do meaningful forecast and futures work, we can start imagining what we call alternative futures. To do this in my academic grounding, we use something called the four archetypal images of the future. These archetypal images came from decades of research into noticing patterns within the images of the future that I talked about earlier that show up in media, art, public culture. And then from like analyzing all of those images and seeing the patterns, we came up with four major archetypes that help us forecast alternative futures and scenarios. So when you're thinking about doing this work or bringing it into a collective that you're working with, you can use these four archetypes to help people parse out different ways that they're thinking about the future and have discussions about which archetypes feel most possible, how we might think about each in our work, what's most meaningful for what we're trying to do. And then pulling from those, you can discern what your preferred vision of the future for your community might be. So the first one is called continued growth. So this is, I think we kind of all know what this means. You see the LA freeway system here. It's the idea that there are no limits to growth. Things will continue on as they are. Trends will increase. Life as we know it will grow, grow, grow. It's very much the capitalist paradigm. We expect to see more of the same, but bigger, faster, and better. That's continued growth. The second archetype that's an image of the future is called the discipline scenario. And you can see the picture here is sort of one aspect of the discipline. The discipline scenario says that we can avoid collapse by bringing in discipline. So that could be authoritarianism. So we control, we maintain, we hold off from collapsing by strict controls through authoritarian governments. It can also take the form of sustainability, regenerative movements, things that control, sort of limit, that hold a discipline around the way that we operate as a society. So this scenario believes that through disciplined actions, we can stave off collapse and continue to grow, although it might be a slower level of growth than the continued growth scenario. The next one, collapse, is pretty obvious. So it's the idea that things fall apart, the center cannot hold, whatever factors come into play, however it actually happens, whatever time frame it is, there's a collapse of systems, and the world as we know it falls apart. The flip side of this is what I call new beginnings. And I think Sue alluded to this too in her opening. It's the belief that things must fall apart for new beginnings to happen, that we must break down in order to break through. So we can hold both of those as a paradox. And I think any of us who've really done deep systems work for some time, you've bumped up against that feeling of like, oh my God, this is so frozen. I don't know how to make change. And so in some ways, when we can get comfortable with the collapse that's happening and really see the new beginnings, the seeds of the new future in the collapse, I truly believe that's where we can lead from most potently in this time. And then the last archetype is transformation. So this is often the high-tech vision of the future. It's, the people, the singularity folks that believe AI takes over and humans become transhuman and everything's great and we go to Mars and all the things. It can also be a high spirituality scenario where people call it New Earth, 5D reality, like we completely transform, things are not anything we saw before, nothing we understood life to be. So a lot of the terms we hear being shared right now that point to a total transformation as a way to like skip over collapse. I think that's how transformation, from my perspective, is being shared a lot right now. That's the transformative vision of the future. Things change completely into a way we've never seen. And so I'd say in this time that we're in, the great turning, polycrisis, metacrisis, what I call the chrysalis, this is my personal forecast from what I've experienced and from what I've seen in this time of the great turning. So the chrysalis, if you know about the life cycle of a butterfly, from the caterpillar stage, it goes into something called the chrysalis, where it literally melts into goo. Its entire body disappears. It becomes like just goo inside the chrysalis. Caterpillar's totally gone. And there's these little cells within the caterpillar's body that had always been there, but were lying dormant. And they're called the imaginal cells. And they hold the DNA that knows how to make a butterfly, right? So those cells who've just been like floating around on their own, not sure why they were there or what they were supposed to do, suddenly find each other and form the butterfly's body. So I believe this is the stage we're in as a society where things are falling apart and things are melting down. In that goo of the chrysalis that is, sort of our social structure, we are the imaginal cells and we're starting to find each other. So we're finding the others and figuring out how to build something else. So in that time, we could expect to experience a collapse of the continued growth paradigm. I think we're seeing that already. So we can see certain things that once felt solid start to collapse. And in some ways, we can celebrate that because, as Sue mentioned, a lot of these systems were inequitable, racist, damaging, violent. So collapse doesn't have to be a bad thing. It can also be the new beginning where the seeds from other ways of being start to grow. So we're going to see a collapse of the continued growth belief that we can just grow forever. And from that, we're already seeing moves to disciplined scenarios where authoritarianism rises, attempts at sustainability and the desire to continue to sustain ourselves on the planet, it just increases in velocity. And this all leads to a transformation of something we cannot yet even imagine. What might be the butterfly of what's coming next, a whole new way of being as humans on Earth. So this is not a prediction, it's more of a forecast and a way of thinking about the moves that may be coming. The hard part that's really difficult to determine is how long this all takes. But from my perspective, it's a future that we get to decide how we want to write it. And by working in more collaborative, collective ways to think about how the communal body starts to think of futures and move in new directions towards new futures. So for those who are interested in understanding the steps to a full futures process, and again, look at this from the lens of imagining the networks you work with, the collaboratives you've already formed, how might you bring this kind of, you can pull different steps from this. You don't necessarily have to do them all in this order, but if you were interested in doing, say, a full futures process on the futures of, community health in Seattle, just throw something out, whatever it might be, you would start with your theory of social change. So you'd have conversations around what is it we believe we're actually doing? What is our theory of change? Once you get to that, you'd be looking at major driving forces and the history of these forces. It's really important to understand how we got to the present moment before we start thinking about the future of what might be coming. So this is the systems work, right? The present condition, the clear-eyed assessment of what is without jumping to what we want it to be. This is just what we're looking at. This is the system as it exists. You'd be looking at dominant trends and what I call dominant emerging issues. So emerging issues are things that are like blips on the horizon. They can be positive or negative. They might be new technologies. They might be new policies that are, sort of bubbling up. They could be patterns that are emerging from existing trends that are suddenly starting to like cross-pollinate and collaborate in ways that are different. So emerging issues are not yet trends, but they're emerging from the field. Once you have a sense of, the history of how we got to where we are, the current system as it exists, some of the trends and emerging issues that might affect our system into the future, then you'd go through those four archetypes and you'd think about, what is the collapse scenario for us? You'd set a time horizon. So you'd think, okay, if we're thinking about 2050, 2060, 2070, whatever it is, you want to get at least 20 years out usually to be kind of useful for futures work. But what is the collapse scenario? What is the disciplined scenario? What might happen in that scenario? What is the continued growth scenario? And what is the transformation scenario? And then once you've got a sense of those alternative futures, you're going to be looking within those to understand, okay, what are the signals in these future scenarios that we want to make sure we avoid or plan for? We sort of know that this piece of discipline is coming down and we got to be ready. And then what are the aspects of those futures that we want to encourage, to amplify, to collectively support? And that becomes your preferred future. So you look at what is the preferred future? What's the vision we're holding as a collective? And how do we want to articulate that? It usually becomes a preferred future vision statement that you can share out with other stakeholders. And then you take that vision statement and you use that to plan and to do sector plans, strategic plans, personnel, policies, funds, day-to-day decisions based on the plans, committing to the futures research to cycle back and look again. Did what we forecast in these alternative futures, did it come to be? Is something else emerging in the field that we hadn't noticed before? What's changed about our vision for ourselves? How has the world around us changed? So you're evaluating, iterating, and repeating. And then I want to situate us. I think Sue knows this. Two loops model of
Yes,
system
it's my
change.
favorite.
Yes, it's so
Yeah.
good. You can do some really great participatory, collaborative convening around this model where you put like tape on the floor. And basically, you're wanting to position yourself in this model. Okay. So systems change is always happening. Like we might think we're in this time of great change. There's always change happening. So there's always a system that's dying, multiple systems that are dying, and multiple systems that are being born. So the top line is the systems that are dying. Bottom line is the systems that are being born. So the key to this picture is to think about where you sit. So are you a steward? Do you sit, sort of in the existing system where you're like, okay, like we're really hoping that this hospital doesn't, break down and that we can hold it together. And we know that things are changing in the world, but this is a really important area for our community and we've got to stay alive. Like you're a steward, even though you know the system may be dying. Then you might be on the hospice side where you're actually, you know the system's dying and you're helping it to get there faster with grace. You want to be a graceful companion to the dying of this system. And then those down below that in the compost section are taking the pieces of that dying system and they're looking at it saying, okay, well, this wasn't all bad. So what in here is good that can become soil for what's coming next? And then if you go to the folks where it says innovators, they're sort of at the beginning of this bottom curve where you've got the new system that's being born. So you've got innovators who've got new ideas. They're kind of in that first part of the bell curve. They're out there creating, trying new stuff. You've got people like yourselves, I would posit. A lot of you are probably in this connecting and nourishing phase where you're making networks around new ways of trying to do this type of work. So like, what does it look like to connect each other, to become networked, to nourish communities at practice, and then to become a system of influence, which actually brings this newly forming system into the dominant paradigm. And then there's some that go on that transition bridge, but so you can see yourself in this map. And when you locate yourself on the systems change map, I encourage you to pay attention to the fringes and to see where you might work with unlikely allies. So how might someone who's in communities of practice reach across to people who are in the hospicing section of a dying system to understand what their needs are and to bring that voice into the communities of practice so we can think about how do we collaborate in this movement from the old system that's dying into the new system that's being born. So I'll just leave you with a few thoughts before we open up for some questions and answers. Like I said, locate yourself appropriately on the transformation. There's no right or wrong answer. There's no good or bad. We're all just navigating a changing system and a changing world. So in your leadership, figure out how you can disrupt at a rate that can be absorbed. So as we're moving through uncertainty, moving through change, different people in different systems and different organizations have different capacities to absorb disruption. So good leadership will understand their audience and will continue disrupting and moving and changing, but at a rate that people can absorb. We have to get uncomfortable with uncertainty so we can lead others through that uncertainty, through the disruption at a rate they can absorb and move with it. And then this is a marathon, not a sprint, right? So this could be generations that we're in this transition. We don't know how long this will take, and it's going to be messy along the way. So making sure that you rest appropriately and that you build cultures of care along the way. So I like to say, as within, so without. I think one of the things we forget most often is to design our organization itself to be regenerative. How do we create a space for working within that people have the space to rest, to think, to be, to connect, to build relationship, where we can model the kind of world we're trying to create on the outside of the organization. So create a culture of care in your organization so that you can create cultures of care in the world. And then I'll just share a little bit. I've got a slide with the book. If you're curious about that, just on the last slide, if you want to show that, or maybe it's not there. Anyway, the book is called Our Beloved Futures, and then I have a podcast called the Beloved Futures Podcast. If you're interested in hearing from, I host different change makers who are doing this kind of work in the world and highlight, the amazing things that they're doing. It's a really hopeful space. And I have a website, Our Beloved Futures, where I share about upcoming events and workshops and things like that. So we'll open it up now for Q&A. I think that's over to you, Sue. Or I guess we just let people, if they have questions, you can go ahead.
Yeah, so
Raise your hand. It's up to you.
amazing, right? It's a lot to kind of absorb, right? Just to think about it. I think there was some great snippets. Lori, I'm so excited that I see you. You're beautiful. And I saw that Josh joined us. I don't know where he is. Hopefully he's gonna show up on camera. But so I think right now, like this time is for us to Christina, are you on here twice?
No,
She's
it
free
kicked
now.
me out. Sorry, it kicked me
It-
out and my screen dropped. Sorry about that, Aubrey.
That's
I will
okay. I
have
was
a link
like,
to your slide. Apologies. I don't
No,
know
it's
what
all
happened.
good.
yeah,
Okay, crazy.
no. Um, no, so I think now, like, we just love to hear any reflections or questions from folks, and just would open it up. Sophia, I saw you had added I love this quote. Definitely going to start using it. I don't know if you have any reflections you'd like to share. I know you're doing some
I
great
love
work.
that because it's something I've actually been thinking about recently because, end of fiscal year, we're so many deadlines and starting like new fiscal years with different activities and different priorities. And especially with our future public health funding, we're hoping to go towards more like an accreditation focused route. And so we're looking to do like a strategic plan and we're going to be coming up really soon on our next Chaw Chip cycle. So pretty much tons of brainstorming and crazy ideas are coming out left
Right.
and right. And I'm very lucky that my boss is a huge supporter of crazy ideas. So it really helps to have that supportive leadership team. So yes, I am all for crazy ideas because you never know. One might actually not be as crazy as you think and could actually benefit the community. So I
Mhm.
appreciate this perspective.
Amazing. I love it. Yeah, keep doing some ridiculous ideas that get out there because that's when you're actually
They're
starting to
the most
engage with
ridiculous
people.
ideas are the best ones.
Do you have any you
Yeah.
could share? Like, is there's one that's top of mind that you have recently thought about?
Ooh. Trying to think. Oh my gosh, you're putting me on the spot.
It's okay. Think about it, and if
Um,
one comes up, put it in the
I
chat.
think I think one big, I don't know. I think in terms of like crazy ideas, ours are more in terms of like we want to do this, but how are we going to with such limited capacities? And so we really try to look for funding opportunities that target these different quote unquote crazy ideas that we have. So I'm thinking like, for example, with all the HR1 cuts, as you know, there are a lot of people who are going to be losing their Medi-Cal insurance in the next year. And so in tiny little Colusa County, we have about 22,000 people. And right now it's about 1,100, I want to say, who are uninsured. That number is going to increase to over 4,000 people by July 1st of next year. That's 20% of our population. Yeah,
Mm.
so it's like crunch time. Any idea is a good idea. And so, fortunately, our managed care plan, which I'm sure many other counties in this call also work with, Partnership Health Plan of California, they put out a funding opportunity to support, to kind of set the foundation for supporting those who are going to be losing their insurance next year. And so we were just looking around like what the heck are we going to do? And someone contacted me from a brand new organization called Gentle Touch Wellness. Brand new, it is a maternal health organization, telehealth focused, but they can do a bit more than it's midwifery owned, but they're also a certified nurse practitioner. So they can do like prescriptions, blood tests, things like that. And so they randomly contacted me and were like, "Hey, we're new. How can we expand and support rural communities?" So I was like, "Oh my gosh, we have a grant that we're working on right now. And why don't, this might sound crazy, but what if we contracted with her to pay for a certain amount of appointments through the grant period?" So it would be, I believe, August it would start and then it would end next December. Um, and it's 50K, and I was like, I don't know. This could work. This could blow up in our faces. I don't know. But we are going to do our best to promote the heck out of this agency and do tons of outreach. And I know it's like a big ask, but I think we can pull it off. It would be their appointments are also a lot cheaper than you would see for if you were uninsured and you were to go to urgent care, for example, like that could be at least $500 versus this organization, Gentle Touch Wellness. I believe a 30-minute consultation is about, I think it was $70. I can't remember the exact number off the top of my head, but like in the grand scheme of things, that is so much less than what you would see in other practices. So we're gonna do it. We are gonna go all in, and we have a very ambitious goal. We have less than 70% of the prenatal population in Colusa County receives early prenatal care as of our CHA in 2024. And so we are hoping that by the end of next year, we want to raise that to 75%. So that's kind of our big, ambitious, crazy idea that I think
Right.
could actually pull off. So I'm excited to see how this is going to go. So more updates to come.
Amazing. Thank you, Sophia. I love
Of
it.
course.
It's awesome. Ah, there's a question here. How do you hold space for disappointment?
Mhm.
Change is difficult, even if it is needed. And sorry, and how long can we sit with the sad and hard parts of change or understanding? Our initial plan isn't working. Allowing space for recognizing something is disappointing while accepting something is dying. Not sure there is an answer to this, just want to hear your perspective. What a great question, reflection. Yes.
Yeah, I
Um,
remember one of my mentors in the leadership development world saying to me, leadership is grief counseling. And I think that's true, especially right now. So there's a way in which I've actually done a lot of learning from folks who are death doulas or grief counselors, or like Frances Weller, who writes on grief, to understand the process of grief within our systems, which I think, and then this like aspect of disappointment, I think is a really important aspect of it too. And sort of, and I think the other side of that is patience, right? How do we cultivate patience and weather disappointment when things don't work out? And part of that too is developing a culture of learning in the organization or network where it's like, okay, this didn't work out. What can we glean from that piece of composting? What can we glean from that? Why didn't it work? What didn't work out? What is the disappointment? What happened? Um, so yeah, just sharpening our skills around all of those as leaders, I think is really important.
Mhm.
And knowing that, I mean, guys, civilizational collapse is not an easy thing to go through. Like we're in, so compassion for each other and just grace as much as possible as we navigate a lot of, real intensity.
Mhm. Mhm. Aubrey, I'm wondering, like, so a lot of the work that we do is with partners, right? Like, who are coming together and navigating all kinds of things. Sometimes the money is very focused on a particular issue. It might also be like community health, whatever. But could you maybe talk a little bit more about how this could be applied? Like you gave the process, right? Which was very, very helpful. Like, or just thinking about if I want to get started,
Hmm.
like what could some of these people do, right? Just in terms of their thinking about how might I even just beginning a dialogue,
Totally.
right? Like, because just reading her note, I'm thinking, well, how do you just mentally prepare yourself? Like, for this is what we're going to do. And we don't know how it's going to turn out, because a lot of people we work with are like, okay, you're going to do A and you're going to get to Z and let's do it, and not allowing for what, some of the stuff of what you're talking about. So just wondering if you could share some of that, right? Just some thoughts on
Sure.
starting and yeah.
Yeah, I mean, I think I'll talk a little bit about starting with the futures process, but underneath it all is this idea of the cultures of care. Because I think if we can build within our organizations spaces of trust and safety and care where we feel held by each other, that's really important as things get, more difficult, so that people feel they can bring their grief, they can bring their sadness, their disappointment, and be held in that, right? So that's really, really an important piece of the work. But in thinking about how do you start, discussions about futures and this way of thinking, something that could be really interesting is for, someone who's wanting to sort of lead that charge to do a little bit of research around trends and emerging issues in the field that you're working in, and looking
Mhm.
at, like how Sophia was sharing that sort of outlier possibility. Like, what are some people trying that's really different? What are different, trends that are happening that might be important for us? And then bring that to a group discussion and have everyone look at like, okay, this is kind of the landscape of what's happening out there. What are your thoughts? What are your feelings about this? What are you noticing? Invite a
Mhm.
participatory discussion. And then that can lead into some of the visioning work where you start to look at, okay, where do we want to go as an organization? What's the world we want to live into? In 10 years, where would we like to be? And start articulating some of that vision language to be shared amongst everyone in the group. Which then can lead into more conversations about around what's coming down, the trends and emerging issues pike that maybe we want to plan for or be aware of, but always attending to that kind of shared sense of being in a caring space, in a space where we can be vulnerable and real with each other, I think is really important.
Mhm. I feel so validated by hearing you say that because this is something I talk about a lot. Like,
Nice.
because I'm constantly, like, every day, I'm always watching, like, and looking and seeing, and I'll share articles with people, and it's like, well, what do you think this means? Right? Just thinking about all of that. So,
It's
and
pattern recognition, right? It's
yeah,
noticing patterns over time and how
yeah,
they start to merge. And oh, I didn't realize that pattern would
yeah,
mix with
like this looks
pattern.
like what it's happening, right?
Mhm.
And I think this spirit of being curious,
Yeah,
right, of like really diving into to what is that and what's being driven by that. But yeah, so thank you. That's awesome. Josh, I'm gonna call on you. Hopefully you're available. I'd love to hear any reflections you have. Yay, there's Josh.
You're calling on me, huh?
That's right. I
Great to
just
see you. So, um, yeah, no, Aubrey, this was great. Really enjoyed it. I feel like I spend too much time in the future. So I thought this was great. I think I'm curious because this is something, and I don't know if you're familiar at all with Ingrid LaFleur's work.
no.
So she does you should have her on her on your podcast,
Yeah, I'm gonna write
actually.
it down. How do you spell her last name?
Um, it's, I believe,
Uh-huh.
Lafleur.
Great.
She's a futurist out of Detroit.
Cool.
And she was a grassroots candidate for Hat in the Ring for a mayoral race. Was doing what we would love all grassroots candidates to do and doing listening sessions to communities around Detroit. And all she kept hearing was people who were just mired in systemic racism and oppression and unable to actually imagine or entertain
Yeah.
possible futures or
Mm.
more hope-centric visions. And so she actually grounded, rather than taking a sociological approach, kind of grounded her approach in Afrofuturism as literature and kind of the entire movement. And suddenly, people in the listening sessions were putting forward ideas of inspiring opportunities and hope. So I'm wondering how, in your work, you encourage folks to imagine beyond the very real oppressive constraints, or limitations, that folks have or bring to the table.
That's a
So
great.
just light
Yeah,
lift
you know.
when we
You know,
close. Yeah.
I think feel like the answer to your question is somewhat in the story you shared, and a lot of what I was trying to share in the book I wrote too is around the like we can't jump over the grief and we can't jump over the harm. Like we have to go into the muck together. And I
Mm,
wonder, from her experience, I'd be curious to hear from her directly. Like, I wonder if some of the listening where people just got to offload and share in a collective space what they'd been experiencing and how horrible it was and how sad they were and how much grief they were holding. Because I don't think we can start to imagine until we've done that first. Or, if we jump
yeah.
ahead of that, then we're sort of imagining from this Pollyannish space that doesn't, we're just going to reproduce the same systems that got us here in the first place.
Mhm.
So I think
Yeah.
and I think a lot of us are really afraid to do that because it's so big. Whatever side of the spectrum you're sitting on, when you really start to feel what we've done to the earth, to each other, it's huge,
Yeah.
really hard. And we're not taught, nervous system regulation, ways to move through what we're feeling. A lot of us don't even remember how to feel. We distract, we sort of like numb ourselves out. So I think there's a lot of work in that space. And as people who are holding community health at the center, that question of like, what is health? What is well-being? And how do we attend to the whole human? You're probably really specifically poised to tend to that part of this work,
Mhm.
and holding people in
Yeah.
that moment. So,
Mhm.
um, yeah, that's what I would say to that really wonderful question. Thank you.
Mhm.
Thank you.
Mm.
And thank
It
you,
just,
Sue, for
yeah,
picking
I
on
know for
me.
calling you out, Josh, but it just makes me think about just how much hate and anger and violence, right, is out there
Yeah.
and just that time, right, to process that and
Mm.
like what has happened, right, before you can actually just go to another place, I think is really, really important. I know, Aubrey, you need to exit out because you need to you're going to another place, right? Another speak. But I just I'm so grateful. Christina and I, when we were planning all of this, I was thinking, man, this would be awesome to do more of this,
Mm.
right? With you. So I'll follow up, just, have more conversations because I think it's just helpful, right? To be able to think, oh, Lori's got lots of hearts.
We'll take them. Yeah, we could dive
Yeah.
into more specific aspects of how you convene and
Yeah, like
really,
just leading through a little boot camp, right?
yeah,
So
Yeah.
anyway, but
Well, Aubrey, yes, thank you so much for joining us. Really appreciate it. No, you need to hop, but I do also want to thank all of you on the call for jumping in today. We do really appreciate your feedback on how these events are going for you all. So I am going to open up just a brief poll, give you all a couple minutes here before the top of the hour to respond. We would love to hear how this event was for you, what else you're looking for in the future, and how we can do better. We truly do read every single one of these responses. We use them to iterate and to improve our processes and the things that we are offering. So again, thank you so much for attending. And Aubrey, just thank you so much for all of
thank
your insight and
you.
wisdom.
mm,
Thanks, everybody. See you soon.
thanks.
Care.
Thanks, Aubrey.